there any effect of creatine on the kidney?
If the kidney is towards a compromised level, then small amounts of creatine will damage the kidney.
Does creatine cause the hair loss?
So this creatine, when taken as a supplement, damages you.
Creatine is like an anabolic steroid or no?
There is problem. Kharab hai, mat lo.
Are there some other effects of creatine on the body and other organs like brain and overall on the general health of a person?
Creatine helps in recovering early, then damage to the muscles, chances of injury also to the.
So in our series of supplements like protein supplements and other things, do they cause hair loss? Today we are going to have a discussion specifically about creatine. This is a very commonly asked questions by our patients and on social media as well, that people do want to know the positive effects or the side effects of creatine, especially in context with their hair loss. So with us today is Dr. Preeti to address this very important topic. And another very useful sort of a discussion or a podcast today. So, Dr. Preeti, jumping to the first question there itself, does creatine cause the hair loss?
So, first of all, what is creatine? Creatine is a dietary supplement. Mainly it is formed of just 3 amino acids, arginine, glycine and methionine.
Yeah.
And the most important work done by creatine is, आप इसको समझो ये coins हैं जो आपको energy देते हैं. So when you are doing a high intensity exercise,
right,
then you need a lot of energy in the muscles. आपको ज़्यादा energy चाहिए, and अगर आप थोड़ा भी बायोलॉजी जानते हैं तो एनर्जी आपको ATP से मिलती है, एडेनोसिन ट्राइफॉस्फेट, एंड इन द प्रोसेस ऑफ गिविंग एनर्जी इट गेट्स चेंज्ड इनटू एडेनोसिन डाइफॉस्फेट. क्रिएटिन कहाँ फिट होता है? क्रिएटिन एंड क्रिएटिन फॉस्फेट, दे एक्ट एज prompt source of energy, converting ADP वापस into ATP.
Back into ATP.
Yes.
Okay.
So ये फटाफट energy formation is done by creatine. It is helped by creatine. So these are coins for, I love to call them coins for energy.
Right.
So they are not in any form of steroid or any anything which damages you. So this creatine, when taken as a supplement, there have been so many studies regarding this. In 1990s, people were crazy for creatine. So there came a series of studies, because then if something gets famous, तो उसके साथ बहुत सारे myths और बहुत सारे dialogues चल पड़ते हैं कि अच्छा है, खराब है, लो मत लो. तो there was a study published not only 2017 but also 2019, then 2022, which gave answers to so many questions. The question which you asked is one of the most asked questions for creatine. Does it cause hair loss? So if I want to summarize, I should say that creatine per se does not cause hair loss.
Okay.
But when we take creatine, we are in a position to do more and more exercise.
Right.
And now it is known that when you do more exercise, your DHT increases.
Yeah.
And if you are susceptible to DHT causing hair loss, and you are in a position where increased DHT will cause hair loss for you, then because of your increased exercise performance, you can have hair loss, not because of creatine.
Okay, so this is a indirect effect of, rather than a direct effect of creatine causing hair loss.
Yes.
Creatine giving you more energy, converting the ADPs to ATPs, giving you more energy to perform those.
It gives you power to
do the exercises, and that exercise
can cause
hair loss. Okay. And can creatine boost your testosterone levels?
So again, there was a study on it. The study was from Korea.
Okay.
They told us that per se, testosterone is not increased
because of
creatine. But as I said just now, because of exercise, DHT can increase. So even if there is no change in free testosterone, but there may be, in 2 of the studies, there was a little marginal change in the total testosterone. But again, it was within normal limits.
Normal. Okay.
So testosterone as such, boosting by creatine causing hair loss, it's not there.
Okay. And suppose a person is losing hairs because of doing very strenuous exercise, that is possible, as you have said.
Yes.
Is there a way to prevent that hair loss due to those heavy exercises?
So high intensity training exercises, if somebody is doing and he or she feels, usually males, they feel that they are losing hair because of this and they are taking creatine also, then they have to take DHT blockers. As we all know, finasteride they have to take, then dutasteride if their doctor suggests, they have to consult their doctor. They have to take 5 DHT blockers so that their hair loss is within limits. Then if they increase cardio or other low intensity exercises, then they will not have those hair loss problems.
Okay.
And also they can have good nutrition and less stress, and so that they are not, they don't go into telogen effluvium kind of phase. Okay. So this all this, when they take good holistic care of themselves along with 5 DHT blockers, they'll be able to prevent such hair loss.
So basically they take 5 DHT blockers, which is like an effective treatment for male pattern hair loss, and they go for slightly low intensity or cardio kind of exercises, and do take proper diet and reduce the stress to avoid other factors which can also contribute to the hair loss. So that's the way in which, if you are exercising and gymming, you can decrease your hair loss. And with that they can always take creatine.
Yes. So again, there were so many studies, creatine le ki nahi le. So now we all know that they can take creatine in proper limits. They can take.
So is it something like an anabolic steroid? Creatine is like an anabolic steroid or no?
So this is something we all should understand. Creatine is not anabolic steroid. Anabolic steroid is the name given to derivatives of testosterone, which in one way or the other, when they enter the cells of the muscles, they act upon the chromosome and the genetic pattern, and then they give stimulus to the muscle fibers. These are anabolic steroids. Creatine is actually something which is not even governed by FDA, US FDA. Anabolic steroids come under jurisdiction, legal issues they have, but creatine comes in good practices. Okay. And it is not governed by US FDA. It is a dietary supplement, because according to so many studies which they have done, we know now. So even if they take a loading dose of creatine for 20 grams per day for 7 days, and then we reduce it to the maintenance of 5 grams or 3 grams per day for a longer period of time, weeks together, say 8 weeks or 4 weeks, then even then there is no problem. Okay. And it is okay to go. So
Dr. Preeti, apart from hair and muscles, are there some other effects of creatine on the body and other organs like brain and overall on the general health of a person?
So creatine is a much researched product, and people now know that creatine has good impact on brain functioning. Okay. First, let us see the skeletal muscle functioning. So if somebody is doing exercise, high intensity exercise, creatine helps in recovering early. Then less damage to the muscles, less the early recovery phase, and then less chances of injury also. Okay. To the ligaments, to the muscles, muscle pull, sprain. The chances of all this is reduced if you are taking creatine, because it helps you to recover faster. Also, it has very good impact on brain tissue. Right. Increases cognitive function, and it improves attention span. In fact, it is now said that it should be given regularly to people above 60 years of age.
Any dose for that?
Dose is about 3 grams per day. Okay. So according to the International Journal of Sports Medicine, they very comprehensively deduced in one of their articles that a decent dose of 3 grams per day for the entire population is fine if they take it for a very long period of time.
It's safe even for a very long time.
Yes. And again, there could be not many legal problems or legal issues for less than 18 years of age, but there have been studies for less than 18 years also. So people can always find out how much to take. But from 18 to 65, 70, 80 years of age, it is safe.
Definitely they can take 3 grams per day.
3 grams per day.
Sometimes it is also, we read can it cause water retention also? Creatine.
So people are very afraid that if I take creatine, I will gain weight and I will, my water retention will be there in my body. So if we take creatine in a loading dose, then what creatine does, when it goes inside the cell, it goes along with sodium. अब सोडियम के साथ जाएगा तो ऑस्मोलैरिटी इंक्रीज होगी, वो वाटर भी अपने साथ लेके जाएगा. सो इट वाज सेड दैट टोटल वाटर इंक्रीज्ड एंड इंट्रासेलुलर वाटर इंक्रीज्ड, एक्स्ट्रासेलुलर फ्लूइड इंक्रीज नहीं हुआ, राइट?
मतलब सेल के बाहर वाला नहीं होगा.
हाँ, अंदर व्हेन इट गोज विद सोडियम तो वाटर गया सेल के अंदर, तो वो इंक्रीज हो गया एंड टोटल वाटर कंटेंट ऑफ द बॉडी इंक्रीज्ड. बट व्हेन इट वाज सीन इन अ लॉन्गर ड्यूरेशन, then it was found that it does not increase water. So it can be safely summarized that water retention for when creatine is taking for a longer time is actually a myth. इतना water retention नहीं होता. Initially हो सकता है, बाद में नहीं होता.
Okay. Now coming to the last question, is there any effect of creatine on the kidney?
Again, people confuse creatine with creatinine, जो kidney से filter होके it's a waste product from our body. So creatine in due course of time changes to creatinine, but since the buffer of creatine is the same in the body, so हमको creatine जो हम खाते हैं बाहर से, जैसे नॉन वेजिटेरियन सोर्सेज हैं एंड बॉडी में बनने का है, तो वेजिटेरियंस में यूजुअली बॉडी में ही बनता है, लिवर, पैनक्रियाज, किडनीज, एंड नॉन वेजिटेरियन सोर्सेज जो हैं, अगर लोग नॉन वेज खाते हैं तो वो बाहर से ले लेते हैं. और क्रिएटिनिन निकला एक्सक्रीशन फ्रॉम द बॉडी इज अबाउट 2 grams पर डे. सो अगर किडनी नॉर्मली फंक्शनिंग है तो कोई प्रॉब्लम ही नहीं है. But even if the kidney is towards compromised level, then small amounts of creatine will not go damage the kidney. But it always safe to talk to your doctor if you have some kidney malfunction and you want to take.
Doubts like this.
Yes, if you have doubts.
Thank you for this again comprehensive video and a discussion on the creatine and its effect on the hair loss and other functions, and whether it is effective and useful for other organs and the daily health kind of living. Thank you, Dr. Preeti, for this.
Thank you. I'm sure people must be having more questions. They can always ask.
They can always write. If you have any questions, you can write down in the comment section below. If you want us to make a specific video about any of the protein supplement, or if you have any queries about that, you can again mention in the comment section below, and we will try to make a video or a discussion video, sort of a podcast about that also. And there are some useful videos related to this topic which are mentioned in the description also, and one of them is given in the link above also, which you can watch if you are interested in that. Thank you very much.
Thank you so much.